Okay, I wanted to welcome you all to Latino Built's virtual training about COVID-19 job site safety. This training is provided by a partnership with Latino Built and Safe Build Alliance, funded by a grant from OSHA, Oregon. I'm Leanna Petrone, and I'm the Executive Director of Latino Built, and I will be facilitating this training today. Please follow these 2 easy guidelines during our presentation. Remain muted for the duration of the presentation. Use the chat feature to ask questions during the presentation. You can find the button on the lower portion of your window, and the chat feature will pop up on your right-hand side of your window there. This presentation is being recorded and will be distributed to our community along with materials in the next few days following the presentation for that. And it is my great pleasure to introduce our presenter, Brian Ortiz. He's our safety expert and managing member of Mosaico Safety.
All right, you guys ready? Let's see. I'm gonna share my screen real quick. Okay, can everyone see my screen? Nod yes if you can see my screen. No? What about now? Give me a thumbs up if you can see my screen, please. Perfect. All right, let's get started. So I'm Brian Ortiz. I've been in construction since I was 19. Just a little short introduction about myself. Been in construction since I was 19, and you know I've had many different positions throughout my career, and I'm now a managing member of a safety consulting company, and also the safety director for Kerr Contractors. So this is pretty much what I've known. It doesn't mean this is, you know, all there is to know. There's certainly a lot of resources you can find, but I hope that going through these courses, you're going to have a basic understanding of, you know, what you need to do as an employer to make sure that you have everything in place to ensure the safety of your employees, and also ensure that you can stay open for business and that you can remain working. So let's start with just some basics right here. So what is COVID-19, right? It's a pretty basic question. And the answer is COVID-19 is just an illness that is caused by a new coronavirus. You guys may have heard it be referred to as novel COVID-19. The word novel just means that it's a new coronavirus. This coronavirus can spread from person to person, and some of the symptoms can include cough, a fever, and shortness of breath. And what makes this virus very tricky is that some people could be infected and show no symptoms. That is what people call asymptomatic. So when we say a person is asymptomatic, that means that they're infected and they're not showing any symptoms, right? So the second question is, how does it spread? In order to know how we can prevent the spread, we have to know how it spreads. You can become infected by coming into contact with a person who has COVID-19. You can also become infected from respiratory droplets. How many times have you been talking to someone and all of a sudden you spit in their face, right? So these are those respiratory droplets that you know, when you're talking, when you're coughing, when you're sneezing, they go up in the air, and then if someone breathes that in, or it gets into their body through their mouth, nose, or eyes, you know, they can become infected too. You can also become infected by touching a surface or any object that has the virus on it, and then again touching your mouth, nose, or eyes. And then one of the most important questions is there a cure? Is there a vaccine? And currently there's no vaccine to protect against COVID-19, which is why this is so important. The best way to prevent infection is to take everyday precautions, right? You have to be actively engaged every day at all, all the time to make sure you don't get infected by COVID-19. You can do that by avoiding close contact with people that are sick and washing your hands often. But I just want you to know that prevention is the key, since there's no cure or treatment for the COVID-19. As an employer, and even as a head of the household, I believe that everything has to start with a plan. You have to be proactive. Like I said, if you get COVID-19, there's no cure. There's no way you can be reactive to COVID-19. That is why prevention is key. So you have to start by having a plan. Um, a plan is going to help communicate your job site safety policy, not only to your employees, but also to the clients, the public, and also to any agencies like OSHA or federal OSHA as well. So what does that plan have to have? I would say that your plan should have site-specific guidelines. Every job site is different, right? What I do for my site is going to be way different than what you do for your site. So make sure that any guidelines that you put into place for your plan are site-specific and they're specific to what you guys do. It should also include employee and employer responsibilities. So the responsibility is not only the employers, right? It's also the employee. There's only one employer sometimes, and there's 10 employees. So if the employees are not doing their part, this is not going to work. So make sure that we're including employer and employee responsibilities on there. And then another thing is, I encourage you guys to include a social distancing officer to your plan. And we're going to talk about what that is, what that means. But it's very important that you include these three things at the very least in all of your plans. So to prevent the spread of COVID-19, the main thing is person-to-person contact, right? So to stay safe, and then some of the policies that you should implement is, practice social distancing. Social distancing means you're going to have to stay away 6 feet or more from any person. And like I said in the beginning, a person could be sick and show no symptoms. So if you're not practicing social distancing, you may come in contact with people that are sick and you don't even know it. So that's why it's important that every time, at all times, you're practicing social distancing 6 feet or more. Another thing I would add is hold phone and virtual meetings like we're doing right now. Rely on Zoom, on your phone, anything you can do to prevent gatherings. And if you have to have a in-person meeting, make sure that you are limiting the number of people to no more than 10. And if you can do it outside, even better. For example, safety meetings. You are required to conduct safety meetings. You cannot tell OSHA, oh, I stopped doing safety meetings because of COVID-19. That is not an excuse. You have to have these meetings, but you can do them over the phone, you can do them over video, or if you have to have them on site, like I said, no more than 10 people, and also try to do them outside. I would also recommend to not allow any visitors without an appointment to your site. And what we've done with the company I work for is we put a bunch of postings in every door, and it says right there, we are closed for visitors. If you don't have an appointment, you're not coming in, right? That's another way that you can protect your employees. So make sure that if it's not communicated on your website or anything like that, get a piece of paper, put your phone number in there and say, we're closed for visitors, make an appointment, and that's another way you can prevent the spread. If there's any work that needs to be done in occupied areas, I can think of people that do residential, such as, remodels or servicing HVAC systems or anything like that. You have to go into people's homes. So make sure that if you're doing work in occupied areas, just make sure that these are strictly necessary. Don't just, keep doing business as usual. If you have to send your employees to somebody's house, make sure that it's because it's strictly necessary. It's essential for them to go to someone's house. If you don't have to do it, it's better if you don't do it. There's no way you can control someone's house or their hygiene or how they're disinfecting. You don't have that control. So if you're going to send someone in there, make sure that it's absolutely strictly necessary. Um, as we know, the order that we have from the governor right now, it's called Stay Home, Save Lives. And I would also call it, protect yourself, but also protect others. Stay at home if you're sick. Ask your employees to stay home if they're sick. Don't return to work, or don't let them return to work unless they have been 72 hours without any symptoms, without the use of any medications. That is a very standard procedure. Is if you've been sick, maybe the next day you feel better, you don't have any symptoms, you cannot return to work the next day. You have to go at least 72 hours without the symptoms. If your symptoms go away with the use of medication, that does not count. So you have to go 72 hours without any symptoms, without the use of medication. So also, if you're sick, let your supervisor know, or maybe if you've been in contact with someone who has the symptoms, or maybe they have a confirmed case of COVID-19, let somebody know. I know that it's very, very stressful to know that you're not going to be able to go to work for maybe a week or two, because you're going to have to self-isolate. But that is your way of doing your part. That is your way of protecting others. And just, you wouldn't want your wife or your kids or your husband to go to work with someone who's sick, right? So take that principle and do your part. Do not go to work if you are sick. While you're at home, in isolation, cover your coughs and sneezes. I always, use my elbow, or use a tissue. If you're using a tissue, throw it away immediately and wash your hands right after that. Another part of being safe at the job site is washing your hands. Wash your hands. And this is going to become a little bit hard for some of the remote job sites, especially construction job sites that may not have access to a sink like we all do at our houses, right? So wash your hands with soap and water for at least 20 seconds. We recommend you do it often before eating, smoking, or drinking. Pretty much anytime your hands may come into contact with your mouth, nose, or eyes, wash them before and wash them right after. After blowing your nose, after you cough, or after you sneeze, before and after you enter a unit, whether it's a building, a house. Every time you're doing that, you're touching knobs and handles, right? So wash your hands before you do that and after you do that if you can. Refrain from touching your face. It's very, very, very hard to do. I'm sure you guys have seen that video on the news where the girl from the news is saying, don't touch your face, and right immediately she touches her face on the video, right? So it's very hard to do. It's something we do without even thinking about it. But like I said, to prevent the spread, you have to be actively trying not to spread the virus. So think about it, try your best, and refrain from touching your face. Hand sanitizer is absolutely fine when water and soap are not available. And we're going to talk about some guidelines for sanitizing. So that's my next point, which is clean and disinfect. Disinfect frequently any surfaces that we touch in the workplace. Try to clean them and disinfect them multiple times a day, like doorknobs, keyboards, desks, any tools, even controls. If you operate machinery, if there's a machine or a piece of equipment that your employees are using or maybe sharing, make sure that we're cleaning and disinfecting often. And I would recommend at the very least, twice a day. If you're going to be using a disinfectant such as a sanitizer, make sure that it's at least 70% alcohol. I've seen some stuff going around that is less than 70%. That is not effective. It has to be at least 70% alcohol content. So make sure before you buy some stuff. Right now, the price of everything has gone up. So make sure before you spend that money that you're buying the right stuff. If you're going to be using a bleach solution, you can buy it from the store. You can buy the disinfecting wipes. But like I said, with the high demand for these items, you have to almost do your own solutions, right? So it's on the screen right there. 5 tablespoons or 1/3 of a cup of bleach per gallon of water is what the CDC is recommending. Or you can also do 4 teaspoons of bleach per a quart of water. So all this information is in the CDC website. You can go in there and you can find how to do your own cleaning and disinfecting solutions. And then the most important part, once we get to the job site, after we're practicing social distancing and all that, then it's personal protective equipment, right? And while you're on site, every employee must have 3 things at the very least. First one is gloves. The type of glove that they use is going to depend on the task that they're doing. Maybe the task they're doing doesn't require a glove. They still have to wear a type of glove. And I would recommend either latex or nitrile gloves. And then if they have to do any cutting or any welding, then use other gloves that are appropriate for that task. Eye protection. They have to wear 100% eye protection, whether that's glasses or goggles or even face shields. Make sure that they're wearing eye protection. And then the third one is a face covering. And a couple weeks ago, the CDC made that recommendation that we cover our mouth and nose, right? And there's a lot of questions regarding that, whether you can use an N95 or should you use an N95. And to my understanding, if you're going to be requiring employees to wear an N95 is considered a respirator. It is a filtering respirator. And if you're not aware of the standard with respirator use, for someone to use a respirator, they have to go through a medical evaluation and also go through a fit testing. So these are also items that are in high demand for the medical field, and the CDC and even OSHA is asking us not to use the N95s if we don't need them. If you're doing other things such as cutting and there's particles in the air and the standard requires you to wear N95s, that's a separate question. But N95s for COVID-19, that should not be the go-to. You can just simply go to the CDC website, and they even have tutorials on how to make your own masks and face coverings. All you need is a cloth face covering that covers your mouth and nose, and that's all you need. So when should you wear one of these? This is when 6 feet of social distancing cannot be achieved here in the state of Oregon. So if there are certain tasks that are critical, that are essential, and you have to be closer than 6 feet, that's when you have to wear these masks. And if you can wear them 100%, even better. So I have some examples and maybe some questions you may have. So for example, what is a site-specific plan? We already covered a little bit about it, but these are things that you should have as an employer. Make sure you have a written plan. Make sure that you take the time to sit down and put together this plan. It doesn't have to be anything too fancy. You don't have to have a whole binder full of papers and that's my plan. It can be 1 or 2 pages. Once you have that written plan, make sure that you're training your employees on the plan. You can have the best plan in the world, but if your employees don't get to look at it, or you don't take the time to train your employees on that plan, then it's worthless, right? So write the plan, train your employees on that plan, and then I recommend you have it available on site at all times. Whether it's in the job site trailer, maybe the foreman's truck, have it on site at all times. That plan should have the name of the project and the phone number of the social distancing officer for that specific site. And as you guys know, there's a lot of new guidelines and recommendations that become available day to day, right? So make sure that if anything is available that wasn't in your plan, make sure you're updating your plan. So I'm going to show you a little bit of a sample. So this is the COVID-19 site-specific plan that we made. It just it states that the following site-specific plan is in effect immediately. It talks in here that our shop and our project sites are close to the visitors, like I mentioned earlier. We in our company, I am the safety director, but I'm also the senior social distancing officer. So that means I'm the social distancing officer for the whole company. And then we have social distancing officers at each job site that are supervised by myself, right? So here's a little example. It talks about exposure there on the bottom. It talks about, if you're having symptoms, doing some work in occupied areas, limiting physical contact. It talks about meetings, and it also talks about the safety meetings, right? So there's a lot of information here. All it is a 2-page document. It's only a 2-page document. It took me probably, well, I have some experience with safety, so it took me about a couple hours to put it together. If Leanna is okay, we can make a template available to you guys to Latino Build, and where you can just have the bones and the meat and bones there, and then you can just plug in your site-specific guidelines. So that is the site-specific plan. It's not very complicated. It doesn't have to be complicated. If you make it too complicated, try training your employees on something that is that complicated. So make it simple, and then it'll be easier to train your employees. It'll be easier for them to understand. So what is a social distancing officer? So employees should consider designating a representative on the company, either a foreman, a superintendent, the owner. Oh, I gotta turn on the lights. Sorry about that. So the social distancing officer, all they have to do is they have to ensure that all the workers are maintaining 6 feet of separation at all times. They ensure that the gatherings do not exceed 10 people. They also make sure that there's adequate hand washing stations available at all times, and they ensure that appropriate PPE is worn at all times. Now, is this one person that has to stand in the corner with with a little binoculars or anything like that, looking at everything 100% of the time? No. This person can be working. It can be a working foreman or a working superintendent, and at the same time, they can fulfill this role. And like I said, on the site-specific plan, you put the name of that person and their phone number, so that if anybody shows up, maybe your client shows up, maybe OSHA shows up and they want to see who's in charge, you have it on site, you show it to them, and you're off to a good start. So AGC and Latino Build actually put together a document, and you can see it on the screen, and it's called the Social Distancing Officer Responsibilities. So if you go to their website, you can find this document, and you can see every responsibility that the social distancing officer has. It's both in Spanish and English. So we'll have, hopefully we'll have the links. Maybe Leanna can send you guys the links for this document. Hand washing stations. Let's talk about hand washing stations. A lot of you guys may work in construction, and you're always moving, right? You're always going from job site to job site. You may visit different job sites in one day. So it is recommended that we have hand washing. It's required that we have hand washing stations available. It's recommended that you have running water inside a unit, even hot water if you have access to it. If you don't have access to that because of the nature of the location of your job site, you can always rent a portable unit from the same provider that provides your portable toilets. I know, and I know by experience, that when you call these guys to say, hey, can I get a couple hand wash stations to my job site, they're going to tell you that there's a long waiting list. There's high demand for these items. So what is the answer, right? What is the answer? OSHA does allow for remote job sites that don't have the access to running water to do something like this. And this is something we did with the company I'm with, Kerr Contractors. We got a cooler. We used one of these spigots, and we installed it. We have water in there, clean water. We put in there that's a hand washing station, non-potable water. We added soap. We have some paper towels. You can't really see them, but this is working great. It's to replace a hand washing station. We didn't have access to any of the above mentioned, like the portable rentals or running water. So this is something that I think we paid, I think $90 for the cooler because it was pretty big, and like $5 for the spigot. So it's $100. Just make sure that the social distancing officer is making sure that the water is clean, that it's not collecting any bacteria in there. So that would be another responsibility for the social distancing officer. And this may seem like it's something you made at home, but that's completely fine. Even Oregon OSHA, actually federal OSHA came out with a publication, and on there it says that it's okay to use water coolers to provide water for hand washing stations. So I hope that helps. Face coverings, I just want to touch a little bit more on face coverings. According to the CDC, I think there's a typo there, but cloth face coverings should fit snugly but comfortably around the side of your face. They should be secure with either ties or some ear loops, and they have to include multiple layers of fabric. They must allow for breathing without restriction and be able to be longer and machine dried without damaging or changing the shape of the covering. Nowhere in there it says that it has to filter out anything. Nowhere in there it says that it has to be a rating of at least an N95. And like I said, if you go to the CDC website, they have instructions on how to make your own. I've also seen some people, and I think some of our guys are using they call them neck gaiters. They go around your neck and they can pull them up and cover their mouth and nose. Just make sure that whenever you're putting this on or off, you're washing your hands before and after you do that.
Brian,
So
does the face covering have to be cotton, any cotton content?
the CDC does not say anything specific about that. It just says it has to be a piece of cloth. So like I said, you can always go to the CDC. They may update that, in the upcoming days, but as of now, it doesn't say specifically what type of. It doesn't even tell you that it has to be a certain type of fabric. So, like I said, the CDC is a great resource for that. And now I know that a lot of you guys, as an employer, you're always worried about what is Oregon OSHA going to do? What are they doing? So actually, myself, in the position I'm in with Kerr Contractors, we received a notice of a complaint that there was. We handled it. They decided not to open an inspection. Everything went well because we were doing all the right things. But OSHA could conduct a complaint inspection. So if they receive a complaint from an anonymous source, or maybe an employee, or even the public, just be mindful that there's a lot of people at home that are not working, right? So they're at home, they're looking out the window, they're seeing 6 of their employees in a 5-foot radius, they're talking. They may call OSHA and file a complaint on that. So what OSHA has been doing is they've been receiving a lot of complaints. And I don't want to speak for Oregon OSHA, but they don't have enough people to send out at one time. So what they've been doing is they've been sending notice of complaints. A notice of complaint kind of looks like this. Oh, here on the left, you can see it. They'll send you a letter like this. And like I said, I'm not saying that they're going to do this every time. They may send this, or they may send an officer. So I'm not telling you that this is exactly what they're going to do, but I want you to pay attention to what this looks like. If you get one of these in the mail, you have to act fast. If you look on there, you have 5 days to respond to the complaint. So what they're doing is they're giving you the opportunity to investigate the complaint yourself, and they're giving you the opportunity to correct the hazard, correct the condition, if it's an actual hazard, and then report back to them. You're sending them, you're accident investigation or incident investigation. They review it, and then they decide whether they're going to open an inspection or not. So they, even after you submit your response, they could still say, well, we're not satisfied with how you did your inspection, your investigation. So we're going to send they can still send a compliance officer out to your job site. So I would say if you get one of these, feel free to reach out. We can help you navigate this complaint process to make sure that you're doing the right things. And also one more thing, beware of scammers, right? There's some people out there going around to job sites saying they're OSHA and they're asking for payment right there on site. They're asking for cash payment. OSHA does not do that. They do not ask for payment. They don't take payment on site. If somebody's asking you saying, hey, you're not observing the social distancing guidelines, I'm with OSHA, pay me $500. That is a scam. So don't fall for that. And there's a lot of resources out there. We're here to help you, and I think I can speak for Latino Built in that aspect that they are here to help you. They're here to provide answers. They may not have all the answers. I may not have all the answers, but we'll try to find those answers for you. There's a lot of resources out there, and like it says right there on the bottom, you're not alone. There's the CDC website, there's Latino Build, Safe Build Alliance, AGC, Oregon Columbia chapter. They're a great resource as well. You can also call Oregon OSHA for consultation services. That has nothing to do with enforcement. So don't feel like if you call them, you're opening yourself up for an inspection. That's not what this is. This is a service they offer. And also, Mosaico Safety is a company that does consulting and safety training. So if you guys need any help, feel free to reach out. That is pretty much all I have for you guys for now. And I believe Leanna is going to have some questions here coming up. So thank you very much. Our contact info is down there on the bottom. And I really appreciate you guys taking the time to do this. And I really appreciate Latino Built giving us the opportunity to share some knowledge. I always say knowledge is the antidote to fear. So if you have more knowledge, you don't have to be afraid. Reach out to the resources, get some knowledge. Thanks to Latino Built, the knowledge right now, it's free. So take advantage of it. And with that, I thank you. And I'm going to turn it over to Leanna.
Okay, awesome. We did have more of a clarifying question in terms of the 14-day quarantine period versus the 72 hours period of time of not returning to work. So who would qualify for each?
So I would say, first of all, I'm not a physician, right? I'm not a doctor. So the first thing you should do is let your supervisor know and then seek medical advice. The recommendation right now is if you should quarantine yourself if you have a confirmed case of COVID-19. Like we know, testing is not really available for everyone yet. So you may have to go home and then wait for the symptoms to disappear. And if the symptoms go away and you can go 72 hours without the use of medication, then you should be able to return to work. Your employer may request you or may ask you to have a letter from the doctor, and I think they're going to. So always just seek medical advice in that aspect.
Okay, so that was our only question. Does anybody else have clarifying questions? We are happy to take verbal questions as well. If you can just unmute yourself and ask the question, I'll leave the floor open. Okay, it looks like we are done with questions.
One thing, Indiana, is I saw it on the chat. Jason is correct. he was talking about the phase 1 in Washington is starting, and the masks are required 100%. When I said that the masks are required when you're within 6 feet, that is for the state of Oregon. So he is absolutely correct. In the state of Washington, the masks are required 100% of the time.
Oh, perfect. Any other questions that I might have missed? Oh.
I have one. So does it, Brian or anybody would know which direction is Oregon headed? Is going to be similar to what Washington is implementing, or how are things going to be phased out here in Oregon? Anybody has any updates on that?
I don't think Oregon is going to go with the 100% masks, because they never really. I think Washington was more strict because they were being hit harder than Oregon. I don't think they're going to go to mask 100% of the time, but that's a thought. So it is better to be prepared and plan ahead, have them available. And if they say, yeah, we're going to require masks 100%, then you have them. So that's like I said, planning is the key. So I would plan on that. I wouldn't think that, I wouldn't just say, oh, they're not going to do it and go about your business. So plan ahead. That's what I would do.
Okay. Here is Latino Built's contact information as well. And I wanted to say a big thank you to Brian for his presentation. That was amazing information. So again, this presentation is being recorded. We will send it out to everybody, and you will be able to use it if you need to train your management, even employees or what have you there. And we want to say a big thank you to Safe Built Alliance, as well as OSHA Oregon.
Thank you.
Thank you.